Okay, so we are back to the 10 rights. Okay, so we have the right education, the right instruction, and the right education. For all the procedures, we have to give instruction to the patient. As I was talking to you about, these patients are already indulged in the Google. So everything they knew, they are going to let you know. And for us, before we instruct them, so they know already that we already knew that they already have searched for it. So be careful in giving education. Be careful in giving instruction. Because if you are going to talk to the patient like the Panadol, Ma'am, I'm going to give you this Panadol. This Panadol is indicated for headache and blah, blah. So the patient will just tell you, or the family member will tell you, I know, I already researched it before you. You see? So even, but as long as you stand in your knowledge that this is right. Whatever you say to the patient, you must have a reference. Okay? So because some of the patients or the patient's relatives, they are with the agreement type. You know, they are just wanted to argue with you. That this is, I already learned about this, I already Googled it. So as if they know better than you. So explain to the patient what are the expected therapeutic and side effects. The therapeutic effects, like for example, the Panadol, this effect is you are going to be relieved in 30 minutes, and there is no side effect. For this is blah, 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 blah. This is how you are going to instruct your patient. So now we have discussed the 10 types, the 10 rights of drug administration. So again, going back, what are the 10 rights? We have the right patient for the right dose at the right time, the right drug. What else? Right, all
Education.
of this right. Right
Right
documentation.
Right drug.
So
Right
drug
routes.
and what to use. What
Right
else?
time. Right documentation.
Right drugs.
Yes.
Right drug and right to refuse.
Yes.
Then right drug interaction and evaluation.
Okay.
And then right history and right assessment. And then right education and right instruction.
Yes, fine. Very well said. So they are the right. We are not just studying it or learning it here. We need to apply it. So all of this, remember this when you are going to give medication to your patients. Okay, clear? Clear. So now we have the diabetic management. So diabetic management, we have to talk about what is the diabetes. So in diabetic management, why did we include it in our lesson? Because this is one of those, it's not fundamental. It is beyond our ADL or our activities of the daily living. But this is included in beyond what you are going to do when you are, especially when you are going to take care of a patient at home or a patient inside of a hospital, but they need you as in 24 hours to stay with the patient. So there are patients who are requesting for someone to stay with them 24 hours, aside from the nurses who are visiting them every now and then. Okay, so it is our duties and responsibilities to provide care for those diabetic patients. And how to do that? We must know first what is diabetes about. So anybody from you in the family that you know there is a diabetes? Okay, so you knew it. So there is in the family, most of our Filipino families, not only our Filipino families, even anybody from around the world, we have in one way or the other, they are in the family. So how to take care of them, how to manage with them, especially those who are taking the medication. Like for example, like those family, like your family, they are taking insulin, right? So whoever knows how to give the insulin or how to manage the patient in giving oral insulin or oral uh, hypoglycemia or hyperglycemia medication, diabetic medication, you should know it. Okay? So we will start with knowing, understanding what is diabetes. So diabetes is a disease. It occurs when your blood glucose, also called blood sugar, is too high. So in diabetes, we have blood glucose or also called blood sugar. Glucose and sugar is the same. Okay, that's why we are calling it blood glucose or blood sugar. So diabetes is with the high blood sugar or blood glucose. So diabetes is a chronic disease that occurs when the pancreas is no longer able to make insulin. So insulin is the one being produced by the pancreas. So if the pancreas is not working anymore, so insulin is not being produced. So there is a high blood sugar. There is a high blood sugar. Yes, there must be a result of blood sugar, high blood sugar. So diabetes as a chronic disease, it occurs, as I said, when the pancreas is no longer, is not able to produce or to make insulin. So when the body cannot make good use of the insulin it produces, so nothing. So now your blood sugar is going high. So there is no insulin to regulate the balance of your blood sugar in the body. So blood glucose or blood sugar is the main source of energy and comes from the food you eat. So most of this blood glucose or the blood sugar, it is the source of energy, carbohydrates. It comes from the food you eat. So most of the food that we are eating, especially Filipinos, 3 times a day or more, we are eating rice. Okay? So it is with that rice content that is full of carbohydrates. So with that I said, blood glucose is the main source of energy. Carbohydrates gives us heat, gives us energy. So when we don't have insulin to regulate our blood sugar in the body, it will result in a high blood sugar. So insulin is a hormone made by the pancreas. It helps glucose from food to get into your cells to be used for energy. So since the body now, the insulins, the pancreas is not producing insulin, so you will be having high blood sugar. So this is the cause of diabetes. Diabetes mellitus or DM or diabetes. Okay, so we know now what causes the diabetes. It's because of the pancreas producing insulin is not working anymore. So insulin, as we said, is the hormone made by the pancreas. It was produced or made by the pancreas. It helps glucose from food get into your cell to be used for energy. But insulin as a hormone, it acts like a key to let glucose from the food we eat pass from the bloodstream into the cells, into the body to produce energy. All carbohydrate foods are broken down into glucose into blood, and insulin helps glucose get into the cells. So it is the glucose that carries that blood into the cells. If there is nothing like good, if our blood cells is full of glucose, so we will be producing hyper the glucose. I forget about it. So we will be having diabetes. Okay? The sugar is going to be higher and higher. Hyperglycemia.
Hyperglycemia.
Hyper is the prefix for high, and glycemia is the glucose. So hyperglycemia is the high blood sugar. So not being able to produce insulin now or use it effectively, it leads to raised glucose levels in the blood known as hyperglycemia. So over the long term, high glucose levels are associated with damage to the body and failure of various organs and tissues. So in the long run, even your organs like your kidneys, your livers, it will be affected by this high blood sugar and it will be damaged. So resulting to the kidney to have the dialysis later on. Okay? So there are three main types of diabetes. There are type 1, type 2, and gestational. So in these three types of diabetes, we will know which one are always predominantly more of for all the population in the world. Number one, we have the type 1 diabetes. This type 1 diabetes can develop at any age, but occurs mostly frequently in children and adolescents. So when the baby is born, most of those babies born with the diabetic mothers, they are having diabetes from birth. Okay, so from baby, so it occurs most frequently in children, with the baby to the children to the adolescent. When you have type 1 diabetes, your body produces very little or no insulin. So which means that you need daily insulin injection to maintain blood glucose level under control. So from birth, type 1 is from birth. So here, it develops from birth. So it occurs in children and adolescents. So when you have type 1 diabetes, there is no production of insulin. And what we need a daily dose of insulin injection to maintain the blood glucose level under control. Secondly, we have the type 2 diabetes. In type 2 diabetes, it is more common in adults. This is started in adults already. Like for example, what is the age for adults? Around 20? Teen? Those 20. So those starting from the 20s, they are called adults and accounts for around 90% of all diabetes cases. So type 2 is more of the diabetic cases. So because it accounts 90% of all the people. So it causes diabetes to people around 90% of all of them. So it originated or it started from adulthood, and it accounted for 90%. So when you have type 2 diabetes, your body does not make good use of the insulin that it produces because the pancreas is already damaged. So there's nothing like the insulin is produced anymore. So now, the cornerstone of type 2 diabetes is in the treatment is healthy lifestyle, number one, including increased physical activity and a healthy diet. So all of this, it is the cornerstone of diabetes 2 type 2 treatment. However, over time, most people with type 2 diabetes will require oral drugs or insulin to keep their blood glucose levels under control. So the same way with the type 1, but type 1 is started from birth, from children up to the adulthood. And type 2, it starts from adults to more people, to all of these people past adulthood, and the 90% of them are with the diabetic cases. So when you have type 2, the same with type 1, the insulin producing pancreas is not working anymore. So it doesn't produce insulin to regulate our blood sugar. So however, in most of these people with the type 2 diabetes, it requires drugs or insulin. So here we come, the nursing aide or the caregivers, they will come in this stage. The patient will be needing somebody like you or somebody like caregivers to be with them, to give them the daily injections. Okay? We have the gestational diabetes, number 3. We have the 3 types of diabetes, the type 1, that starts from the birth to the adulthood, the type 2, from adulthood, and the type 3 is gestational diabetes. So this type of diabetes consists of high blood glucose during pregnancy only. When the mothers are pregnant only. It started during their pregnancy and is associated with complication to both mother and the baby. Okay, so it is the diabetes that has occurred during the mother's pregnancy. So it is associated with complications to both mother and child. So GDM as we call them, or gestational diabetes as we call them, usually appears after pregnancy, disappears after pregnancy because it only came out during pregnancy. So definitely most of these mothers, most of them, it disappears after pregnancy. But women affected and their children are at increased risk of developing type 2 diabetes later in life. Okay? So we got it. We have 3 types of diabetes. So number 1, we have the type 1, which is from birth up to adulthood. 2 is the type 2, which starts from the adulthood and comprises 90%. And 3, we have gestational diabetes or GDM. It is the type of diabetes that has mothers who are pregnant are having high blood glucose during pregnancy period. Okay, so what are the symptoms? What are the symptoms of the diabetes? Usually, our family or friends, we are just knowing that they are just letting us know. One of our friends or one of our family members just letting us know that, oh, I have excessive thirst. Something like, okay, because he was just under the sun, long time standing under the sun. So he must be thirsty. Okay? So another will say, oh, I'm always urinating. I'm always passing pee. So I'm always going to the toilet most often. So polyuria is the increased urine. So you said, yeah, because you took or you drink so much, lots of water, you drink lots of water. So you are going to pee every now and then. So again, you will see one of your friends or one of your family member, there is a drastic weight loss. You are going to have to acquire a beach body now. You are losing weight. So losing weight, good. So you don't know that this patient is going to have diabetes. Number 3, hunger pangs. Those patients or those people who they are really hungry. They wanted to put in so much of this food in their mouth. They are hungry all the time. So as if you are, because you were dieting for how many days? So this hunger is from that dieting. So fatigue. Oh, I don't feel going to the at work today. So I feel like I'm weak. I wanted to stay at home to just rest. So like fatigue, you feel like lazy. You feel like weak. So skin problems. Sometimes patients of diabetes, they have skin irritation. They have itchy skins. So this is one of the problem for diabetes. So slow healing wounds. These patients, like for example, there is a grown nail. You know the ingrown nail? This is started from here. And there is a small cut in here. And it doesn't heal anymore. So it's been long time. This wound doesn't heal. So you were just thinking, maybe it needs antibiotic. So better go to the doctor and check with the doctor. So when you came to the doctor to see the doctor, and it found out that you have a glucose problem. Okay? So, slow healing of wound, this number is also there. And for the ladies, there is that yeast infection. We know that infection, that yeast causes infection, and it lives in a moist environment. So women, during their menopausal period or before that, they have this yeast infection. So yeast infection is one cause of diabetes. So again, there is an infection. So you are thinking, go to the doctor. And that is, you have to go to the OB-GYN because there is itchiness in the private part. So you don't know exactly that during this time you have already one of those symptoms that already appeared, but you are just so ignoring. So you don't know that these are the symptoms that's going to be a part of that diabetic process. So last is the tingling or numbness in the feet or the toes. So there you will feel there is like, that needle pricking on your toes, or there is kind of like pricking on your feet. So this is the tingling, or there is like a numbness. Sometimes you don't feel like you are feeling something in your feet or in your toes. Okay? So these are the symptoms of diabetes. So we must not ignore one of this. If you found your friend or your family member or any of your close contacts who are coming to you to just saying something like, I have this, one or four of these symptoms are there with your friends, you better ask them to seek the medical advice. Okay? So these are the symptoms of diabetes. So what to do with the management? What is our goal in managing diabetes? Okay? So if we are already confirmed that our patient going to take care of has diabetes. So you as a nursing aide, what is your goal? How do you what are you going to do to manage diabetes with your patient? So if you are going to help your patient with managing their diabetes or keep them at least to the normal or to reduce those diabetes something in their body, so you will be happy because you are going to help them heal. You are going to help them be treated. So like for example, when you come to them, this high blood pressure for this patient or the hyperglycemia for this patient is too high. But since you came to help with the management of diabetes to your patient, the diabetic blood sugar already came down to the normal. So of course, you will be so happy, right? That you help your patient, and through your help, your patient already healed or almost healed. So number one of your aim is to keep the blood glucose level of your patient to the normal as possible by balancing food intake with medication and activity. So when preparing food for your patient, you have to check the food that is going to be eaten by your patient, like carbohydrates. It is not good for the patient to have more of the carbohydrates. So you are the one going to feed your patient. You are the one going to prepare for the food for your patient. So better prepare a healthy diet for your patient. From the morning, you give her blah blah. In the lunch, you give her little of the carbo. So in the night, you don't give him anything of the carbs. So like this way, you are there to help your patient to go back to at least normal, if possible, by balancing the food intake with the medication that you are going to assist in management of patient medication, and keep the patient going by doing some activities. So if the patient cannot do the running or cannot go out from the bed, so it is up to you how to help them, how to do their some exercises. Okay, so immobilize the patient. Let them, you do the passive exercises, because most of these old patients that you are going to look after, most of them are bedridden. They will not be able to get out of the bed for exercise, for active exercise. So now, what is your duty and responsibility is to help them. Like for example, the physiotherapist came for your patient. So when the physiotherapy goes, so he will just for sure going to instruct you. These are the exercises needed for the patient because of his diabetes. So you, as the nursing aide, will do this to your patient. Will do the passive exercise. Passive exercise is we are the one doing the exercise for the patients. So number two is to maintain patient blood cholesterol and triglyceride lipids level as near the normal ranges as possible. So if we have done already with the food, we have done also with the medication, we have done with the physical activity. Now, we will go back and try to check the blood cholesterol and triglyceride lipids of our patient. How? With the food intake. So as you are preparing for the carbs, now you have to prepare also to limit the foods that contains more of cholesterol, fatty foods, and triglycerides. Those the same way. Those with the fatty milk, with the fatty oil, and all of this that contains from the food with triglycerides. So keep them as near the normal ranges as possible. So what do we do in managing the diabetic patient again? So there are three. To manage diabetic patient, we have three things to do. Number one, we have to prepare healthy food for the patient. Okay, one, food for the patient. This is how to manage them. Secondly, we have to help them with the physical activity or physical exercise. Thirdly, we have to we have to monitor or maintain a regular intake of medication. This is where we are going to give the oral medication and the injection of the insulin. Okay? So with the diabetic management, we have three essentials that we need to do to manage the diabetic patients. So number one, as we said, preparing healthy food for the patient. Second is the physical activity or the physical exercise. And thirdly is the regular intake of medicine. Insulin, number one, and other diabetic medications are designed to lower blood sugar levels when diet and exercise alone are not enough, are not sufficient enough to manage diabetes. So effectiveness of these medications depends on the timing and the size of the dose. So medications you take for conditions other than diabetes also can affect your blood sugar level. So according to the rights, we have the rights of the drug interaction, right? So here, we know that some of the diabetic medications are interacting with some of the diseases your patient has. Like for example, he has the diabetes, and those medication for diabetes has conflict or there is interaction with the medication the patient is taking for the heart. So, darling, excuse me. I will take my battery. Hold on. Okay, sorry for that. My battery, I missed it. Okay, so those medications for the diabetes that you are going to give to your patient has some interactions with the other disease that the patient has. So you must be careful also with this. Okay, so we get three elements that manage the diabetes. Now we go with the blood sugar monitoring. How to monitor out the patient blood sugar by using the glucometer. So we have to check the blood sugar of the patient. Before we give the insulin, normally the doctor's order is you check the blood sugar before giving the insulin. So if this is the order, so we as the nursing aide, we have to know, we are to be competent enough to do the blood sugar checking for the patient by the glucometer. Blood sugar monitoring is also glucometer testing. Okay? So the blood sugar monitoring device is also called glucometer machine, test machine. Glucose is blood sugar. Sugar is glucose. Okay? So a blood sugar test. This is the test now. We have to do a blood sugar test to our patient. So a blood sugar test is a clinical procedure that maintains the amount of sugar or glucose in your blood. So we will do a blood sugar test to the patient. So to monitor blood sugar using blood glucose meter, glucometer, blood glucose or the blood sugar machine with test strips and blood drawn from their fingers for instant measurement. Okay, so this is what we are going to do. So the benefits of maintaining a blood glucose level that is consistently within the range of 4 to 7 millimole per liter will reduce the short-term, potentially life-threatening complications of hypoglycemia, as well as the occurrence rate and severity of the long-term complication of hyperglycemia. So what are the complication of hyperglycemia? So there are the conditions that has the glaucoma for the eyes, your liver, your kidney. So all of these are going to be affected. So monitoring or managing diabetes for blood sugar test in 2 ways. How are we going to monitor or manage diabetes for blood sugar? Number 1 is by a prick on the finger using a glucometer. Okay, this is what we are going to do. So we need to prick the finger using a glucometer for our daily testing. So number 2 is by drawing a blood. So there are 2 ways to monitor. But for us, we are going to take a prick on the finger using a glucometer. Okay, so this is one of our role now. So we have to prick the patient and check the blood sugar level. Okay, then the procedure. Just imagine this procedure that we are going to do, because once we are in the practical, the same thing, the same way, I'm going to introduce it to you. Then in the second time, you will be the one to return demo. Show me the skills, your skills in doing this. Okay, so the procedure itself, just go with the theory. Just something like imagine that we are doing it right now. So for all the procedure, any procedure that you will do, you will perform. Don't forget, number 1 is to wash your hands or hand sanitize. So first thing in all procedure, hand sanitize or hand wash. Second, you have to explain the procedure to the patient. You just don't come and prick the patient. No, you have to explain the procedure to the patient. So just like, for example, you are going to prick the patient by the glucometer. So explain to the patient, Baba, I came because it is time for you now to check the blood sugar. So I'm going to check your blood sugar by pricking you a little of that prick to take the blood and check it with this machine. So this is how you're going to tell your patient. Okay? So once you have explained the procedure to the patient, prepare your equipment, or the other way around. But better, you have to explain first. Then, once you explain, the patient said, yes, okay. So now, prepare your equipment. So what you are going to prepare with this procedure? Glucometer, you have to take the device